Emergency room, Bobby speaking.
Good afternoon, this is Dublin Fire Brigade. We are on our way in with a 42-year-old male who was involved in a rollover incident off a quad on a farm. The patient has a dislocated right shoulder, close fracture to the left radius ulna with a laceration to the left forearm. There is no LOC. His vital signs are pulse of 110, respiration of 18, blood pressure of 148/84, his SpO2 is 98, blood glucose is 6.2, temperature is 36.5, GCS is 15, our ETA is 10 minutes.
Perfect. Thank you so much.
Thank you.
Hi guys, how are you? Hi Bobby.
Good. We have Francis coming in. He's 42 years old. Rollover incident on his quad at the farm. So he has a dislocated right shoulder, close fracture of the radius ulna on the left side, no loss of consciousness, and ETA is 10 minutes. We got his vitals as well. So the pulse is 110, breast is 18, blood pressure is 148/84, oxygen level is 98, blood glucose level 6.2, temperature is 36.5, and he's 15 on the Glasgow Coma scale.
Okay, so he's awake, it's pretty stable, so let's just make a plan. You have to be the airway doctor.
Yeah.
And the guys, you can take a full IPC. We'll keep him, make sure we keep him warm because he's a bit of a lower temperature, give him some oxygen, and then we'll make a plan when he arrives.
Sounds good?
Thanks.
Sure.
Morning, Bob, how are you? Morning. Hi, good to see you again.
Good afternoon, Rislav. This is Francis, 42-year-old farmer who lost control of his quad and he was driving at speed, hit it by himself. He was involved in a rollover and it involved both arms being trapped. His injuries currently are dislocation to the right shoulder. He has a close fracture to the left radius ulna. He also has a laceration to that left arm. Bleeding is being controlled. Fracture is being immobilised, and we've also taken one recording and pelvic order. Francis has been administered 1 milligram of paracetamol, 1 gram paracetamol IV, 600 milligrams of ibuprofen kilo, and he's also had 10 milligrams of morphine IV.
How's this going now?
His pain was at 9 out of 10, and he's at a 4 out of 10 now, so it's been brought under control. Other medical conditions, he has a history of Erb's palsy in that right shoulder. He also admits to taking alcohol and cocaine the previous night, and that he was speeding on the quad. He doesn't have any other medical conditions and he has no allergies to medications. Currently his vital signs are his pulse is 110 irregular. He's got a respiration rate of 18. He's got equal and bilateral breath sounds. His SpO2 is 95%. He has full CSMs. His blood pressure is 148/84, temperature of 36.5, and blood sugar of 6.2, and he's got a GCS of 15. So he's had no LOC throughout the full response.
We've got him on some maintenance foods.
And maintenance needs as well.
Thanks very much. How are you, Francis? How are you keeping? My name is Miro. How are you? I'm one of the emergency medicine doctors here. And that's my team here, nurses and another doctor. We're going to be looking after you, okay? So we're going to be gently moving you on to the emergency trolley, okay? Okay, are you with us now? Yeah? Okay. Okay, let's do this now, okay?
So if someone wants to take control of the arm so it doesn't fall.
So
You're going to call it, right?
Prepare to move.
Hold on. How's the pain, Francis, now?
It's sore on the arm.
we'll hand over to you. We'll just wait over here.
Brilliant. Thank you, Andy. Thanks so much.
Alright,
Thank you, guys. Let's look after Francis now, okay?
Just gonna get some of these on you here, Francis. Let me know if you're in any pain or discomfort.
Hey, Francis, we might take you off that hard board, okay? So it's not uncomfortable for you. Okay, would you mind, guys, helping us take him off the board, please? Okay, Francis.
Yeah,
Is the pain manageable now, is it?
So,
It's sore, is it? Yeah, okay, don't worry, we'll look after you now.
So we just need somebody on the head to remove the strap.
Okay, there we go, put it in now, brilliant.
Unless the board's off with the floor. I understand.
Feet. So control the arms.
And then I'm just going to take.
Just make sure.
And I take
Ow.
this to the hand.
Sorry about that, Francis.
Yeah. Okay, perfect.
How's the neck feeling there? Okay?
it's okay.
This
Yeah.
side?
Okay, so you just re-slide
And
through
then manage the legs too. Just manage the legs.
Ah,
Okay.
ah,
Well done, Francis. That's it. Well done.
ah.
Slide out.
And then
Okay.
squeeze yourself that arm.
Okay. Yeah.
So a little bit of movement here. Okay.
Well done,
Francis. Thanks a million, guys.
No problem.
Okay, don't mind this shoulder as well. Okay, how are you feeling, Francis? Sore? I'll give you some extra medication for the pain, okay?
Okay.
Thanks, guys. See you later.
Thank you. Alright team, I'm just gonna stabilize his C-spine. Francis, are you still doing okay?
Yeah, pains, but it's 6 or 7 now.
Pain's getting a little bit worse. Okay. Do you mind keeping an eye on the vitals as well?
Sure. It looks like his O2 stats are dropping. Should I give him some oxygen?
Yeah, let's get some oxygen going.
It's
And
cold.
you feel a little bit cold? Alright, Francis, we'll take care of that as well.
I'll grab him.
Do you mind getting some bloods going just so we can send that up to the lab? Perfect. Okay. We're gonna warm you up here now, Francis. Let me know if you're feeling a little bit better, okay? Okay, we're just gonna have this go on top of you again. Alright. How are you feeling now, Francis?
It's a bit, kind of okay.
Feeling a little bit better? Okay, is that a little bit warmer for you now?
A bit.
A bit warmer? Okay.
Francis, look, just look at your arm.
Hi, guys,
When's the
how are
last time you had your tetanus shot?
I don't remember.
Don't remember.
Okay. So let's get a tetanus shot going as well then.
How's it going?
Okay, so we have Francis
Hi, Francis, how are
stabilized.
you?
How are you feeling now, Francis?
Just worried about my arm.
Alright. Do you want to tell us what happened yesterday? Just give-
I was out last night. I was drinking and the drugs as well. I fell over in the quad. I was worried about my arm. My right arm have Aaron's palsy. Just worried it'll get worse.
Okay.
I don't know to find out about the drugs either.
Drugs, okay, yeah. That's okay. We're just here to take care of you. We will be running a tox screen as well. Are you okay to do that with the full blood count?
That's a good idea, yeah.
Perfect, okay. Alright, and you're worried about the arm, so we're gonna take care of you now and you're all good. So should we call radiology, get
absolutely,
CTs,
yeah.
x-rays as well?
Perfect, yeah. And how is the pain now?
About 6, kind of.
Okay, so it's getting a little bit worse than when you came in today?
6 or 7, yeah.
Okay. Do you wanna get some pain meds going as
Yeah,
well?
absolutely,
Do
yeah.
you mind getting some morphine from him? We can help you with the pain a little bit.
And you're keeping him warm, and what's the vitals?
Oh, the vitals are getting better than when he came in. So O2's at 99 and pulse and heart rate looks good as well.
Brilliant.
Yeah.
Okay, now Francis, we might need to take you down to the radiology department, okay? Do a couple of scans and x-rays, just to
Okay.
see what injuries you have on your arm. Okay?
Okay.
No worries. Okay, I'll just gonna get in touch with radiology.
Perfect. All right, thank you so much. All right, Francis, are you feeling a little bit better now? You feeling warmer?
A bit, yeah.
Okay, amazing. And don't worry about your arm. We're here to take care of you today.
The radiology report is in. Would you like to come see it, Bhavya?
Of course. Okay, so there's an obvious radial and ulnar fracture on the left side. There's an anterior inferior right shoulder dislocation. So we should definitely take a look at that. I'm thinking we'll probably need surgery for the left arm, but I think the right one we can reduce while we're in the room before we send him up.
Okay.
Okay, we'll wait for our doctor to come in.
Hi guys, how are you? How's
Good,
it
how are
going?
you?
Okay, how are you?
Good. We got the radiology report in. So on the left side, obvious radius and ulnar fracture.
Okay,
So
okay.
I think we're gonna have to call ortho for that.
Right.
Possible surgery. And then on the right side, we have an anterior, inferior, right shoulder dislocation, which I think we can reduce in the room, if that's okay with you.
Okay, yeah, we can do that under sedation, yeah, so
Perfect.
that's the plan, yeah.
Yeah, so let's get Francis in the loop and then we can go from there.
Brilliant, okay,
Amazing.
that's the plan, okay.
Alright. Francis, how are you doing?
How are you, Francis?
You okay? Okay, so we just got the radiology report back in. We are gonna have to take a look at your left arm, so we're gonna call ortho for that, if that's okay. And they're gonna take a closer look at it. And then on your right side, your shoulder is a little bit dislocated, so we're gonna take care of that in the room. But you're in really capable hands, and we have a great team here for you. Okay? Alright,
So what
amazing.
is going to happen for the shoulder, we might give you a little bit of sedation and just try to fix it here, but you shouldn't feel any pain, okay?
Yeah.
So you're in a good hands, we're going to look after you, and the orthopedic surgeons are going to come and see you in a few minutes, okay?
Okay,
So I'll see you later again, okay?
okay.
Okay.
Sounds good.